Well, hi everyone, I'm Judy Elliott. I'm coming up today on Lifestyles for Women. Did you know that stroke is the 4th leading cause of death in the United States and the #1 cause for disability? Throughout the month of May, Hamilton Medical Center encourages you to know your risks, control your risk factors, and work with your doctor to eliminate or manage your risks. Hannah Jones from Hamilton Medical Center is here to talk about this and more coming up today on Lifestyles for Women. Stay with us. Well, hi everyone, and welcome again to Lifestyles for Women. Today we're going to be talking about a very important subject, and that is strokes and the risk factors we're going to be talking about, as well as timely things that you should do should you be having a stroke. With me today is Hannah Jones, and Hannah, thank you so much for being with us here today.
Thank you, Judy. Thanks for having me on for such an important message to get out.
Definitely so, and I know that May is a month that that Hamilton Medical Center is really pushing for people to know about stroke and the risk factors.
Sure. Stroke is a devastating disease, as you know. As you mentioned earlier, it's the 4th leading cause of death in the United States, and also the 1st leading cause of disability. And it's important to know that anybody can be a victim of stroke at any time, unfortunately. So it's very important to realize your risk factors.
Right. And you know, we talked a little bit earlier before we started taping. A lot of people think that stroke is just really going to be happening to the older generation, but you see that.
We see a lot of young people with stroke. And it is it's a very scary thing, so it's important to realize what the symptoms are and be able to recognize that for yourself and your family members.
Right. Well, let's get started talking a little bit about strokes. Sometimes we hear a lot, usually only hear about the aftermath after the stroke. Why is it important to educate about stroke awareness? And we talked a little bit about that, but I think a lot of people just don't really know.
Sure. The importance of getting the word out and getting the message out about stroke awareness is hopefully that we can treat more people in a timely fashion. Stroke treatment and technologies in stroke treatment have advanced significantly in the past few years. And the more that we can get the word out there for people to come to the emergency room as fast as possible, because time is brain, the better chances of survival that the patient has.
Great. What exactly, when you talk about a stroke, what exactly is a stroke?
So another word for stroke is a brain attack. Most of the strokes are caused by a similar process that would cause a heart attack. So it's a blood clot in the brain usually, and it prevents the oxygenated blood from getting to the tissue that the brain needs, and then the tissue dies in the brain. So it's similar to heart disease, called a brain attack.
Now, what type of person would be more, I guess, at a higher risk for strokes?
There are some specific populations that are at high risk. The people with high blood pressure are extremely high risk for stroke. Also, high cholesterol and diabetes are also high risk factors for stroke. So if you do have any of those things, any of those issues, you would want to make sure that you are compliant with your medications and saw your physician regularly and monitor those values.
So make sure that you follow the instructions that's given by your doctor.
Yes.
What I know when you talk about symptoms of a stroke, what are some of the symptoms of a stroke?
So the easiest way to remember is the FAST acronym.
Okay, let's pull that up because you brought some information to show. Let's look at that.
Okay.
All right.
So this woman is having a stroke. You can see that she's got some facial drooping on one side. If you were to ask her to smile, one side of her face would not elevate the same, and that would be an indication for a stroke. So the F in the FAST tool stands for face.
So let's go through these, walk me through each of these.
Okay, sure. Parts. So the F is for face, and you, like I said before, you'd have the patient or the person smile to make sure that if they smiled evenly on both sides, that would be a normal response. If only one side was elevated, that would be an indication for stroke. The A stands for arm. You would test that by having the person hold out their arms in front of them. If they had one extremity or one arm was weaker than the other and drifted down, that could be an indication for stroke as well. The S stands for speech. You would have the person state a simple sentence. If they had slurring of their speech or difficulty finding words, that also could be an indication for stroke. And T is the most important in this acronym for FAST because it stands for time. Like we said before, if you have the symptoms of stroke, you need to call 911 and get to the emergency room as soon as possible.
Okay, because time is of essence.
Time is brain, Judy.
Right.
Yes.
Very interesting. And I don't think people really recognize that it is a time factor involved
It
here.
is.
You know, we talked a little bit earlier too. Some people may have something like this happen and then it kind of goes away. They're left very tired and they're like, well, I'm okay now. There's no need for me to go to the hospital.
Right. You know, the public has a really great understanding of heart attacks and chest pain and left arm numbness associated with that, but not a great understanding of stroke and the signs and symptoms of stroke. A lot of times you may have a headache with stroke, but a lot of times it doesn't hurt. So you don't think to call 911. You think, oh, I'm having some weakness or some numbness, dizziness. I think I'll go lay down and take a nap. That's probably actually the worst thing that you could do.
Really?
Because a lot of times the symptoms might start off minor, but if you were to nap and wake up, you may wake up with devastating effects from stroke.
Oh. Wow. So
Yeah.
it is very, very urgent to
Nothing to be
get
ignored.
Exactly. So if someone it feels or sees, let's say that you have a family member and you're recognizing something's going on with them.
Sure.
Definitely you need to call 911. If you have to experience this yourself, same there.
Yes,
as well.
absolutely. Call 911, activate the emergency response to get you to the hospital as soon as possible.
What's the difference of driving straight in your car? Okay, I got to get to the hospital. I'm able to drive. I'm thinking to myself, I'm able to drive, versus calling 911.
It's all about time, Judy. If you call 911, EMS plays a huge role in our stroke team. They're able to recognize the signs and symptoms of stroke in the field and call ahead to the hospital. This mobilizes a whole team that's going to be ready for you when you get to the hospital, to the emergency room, as opposed to if you were to drive yourself.
Oh my goodness.
We wouldn't have that advanced knowledge. Also, they do things for us like start an IV, take vital signs, and EKG. It just, if you were to go by ambulance 911, it cuts down on the time to get you treated.
Definitely call 911 on
absolutely.
those symptoms. Well, we're going to take a break here, Hannah, and when we come back, we're going to also, you're going to be giving us a firsthand story of someone who's had a stroke, and unfortunately they couldn't be with us today, but you have the story and will share with us. We appreciate it.
Sure.
All right, stay with us here on Lifestyles for Women. We'll be right back with you in just a moment. Welcome back again to Lifestyles for Women. As we continue today, we are talking about strokes and how to recognize should you be having a stroke or a family member is having a stroke. And continuing this show today is Hannah Jones with Hamilton Medical Center. Again, thank you for staying with us, being with us today. We talked a little bit earlier about the risk factors and kind of showing what to do and the steps to take. But today there's also a story that you will be sharing with us and with someone that it's really a good story, but it's a great story to share. Let's talk about that.
Sure. We have a beloved coworker at Hamilton Medical Center. She's been a certified nursing assistant for years, and now she works in the physical therapy department as an assistant. She suffered a stroke in February of this year. It was actually on Valentine's Day.
Really?
It was late in the evening on Valentine's Day, and she was at home with her 8-year-old grandson. And she started having some weakness on her right side and some issues, sudden onset of right-sided weakness. And her grandson realized that she was having a stroke from a magnet that was posted on her refrigerator from some community awareness that our program had done in months past.
Are you serious?
The 8-year-old grandson recognized that his grandmother was having a stroke. He saw from the FAST tool that we talked about earlier that she was having some facial drooping and some weakness on the right side. So he called 911. He did absolutely the right thing. And EMS came to pick her up at the house, was able to mobilize the stroke team at the hospital. We met her at the
my.
emergency room doors when she came in. And we were able to treat her, and she received that clot busting medication that we can give if the patient presents within the early time frame, and we actually aborted her stroke.
My goodness.
She was, in essence, cured the next day, and was discharged, went home the next day.
My goodness, what an amazing story.
Powerful. Yeah.
Absolutely. You know, it makes you want to make sure that you have that fast FAST.
It makes all those days of handing out those magnets worth it.
Yeah, definitely. So, you know, and you would never have thought that, you know, an 8-year-old would have noted that to be on the refrigerator to act.
Children are very resourceful, and they're really receptive to stroke education. I think it's really important to get into the schools to educate those children. And he identified it in his grandmother.
Right. That is very interesting to know. In fact, as you said, you know, why not teach your child, you know, at home to recognize, and then if you're out and have the go to some of the health fairs that you have, definitely pick up one of those and put it on your refrigerator.
Yeah, anybody can use that FAST tool, and it can be taught to children.
Right, that's very
Pretty
good.
simple.
Now, I know we talked a little bit in the first part, since we've got a few minutes on this segment, about risk factors. And we went into some of that, and I know you mentioned earlier too that lifestyle is also one of the can be a risk factor as well.
So there's some things that we can't do that can control our risk for stroke. Like as we get older, we have an increased risk of stroke, and we can't do anything about that. African Americans have a higher incidence of stroke as well. Genetics comes into play. You know, the genes that we're born with. Some people are just more likely to have heart disease and stroke, but there are some things that we can control. 80% of strokes are preventable if we change our diet and exercise, and then number one is no smoking. The same thing we hear for heart disease. Diets rich in fruit, vegetables, lean proteins, low in fat, moderate exercise, 30 minutes a day, and then of course no smoking.
Right. You know, that exercise plays into every one of these, doesn't it?
It's good health.
Yeah. And if you really think about it, there is a very close connection, as you mentioned, with heart disease or heart and stroke.
It's the similar disease process, just in different organs. Absolutely. And I want people, you know, people associate a heart attack as an emergency to call 911 every time. I want to help convince people to consider stroke a medical emergency as well. It's just as important.
Right. Great education that you're doing with this. And we're going to take a break, and when we come back, we're going to hear some more educational information, Hannah, that you're going to be providing to us. Thank you again, and thank you for staying with us here. We have much more to come here on LifeStyles for Women when we talk more about strokes and how to prevent them. And we'll be right back. Thanks for joining us back again on LifeStyles for Women. We are continuing talking about stroke, and with me is Hannah Jones, who is the clinical resource nurse at Hamilton Medical Center. And Hannah, again, we appreciate you taking time to be with us today.
Sure. Thank you for having me.
I know that we talked a little bit about it's very important to call 911 to get to the hospital when you see symptoms of a stroke, and we're going to be showing those again today. But what happens when a person is brought into the hospital, and the fact of, you know, just what happens when 911 brings them in? Sure.
We have a team behind the scenes that is mobilized while the patient is coming in from EMS. So you have a team waiting on you when you come to the emergency room. You're greeted by an ER physician, and they'll do a brief assessment on you. Our lab technicians will take some blood, then we take some samples from you. Then you'll go straight to the CT scanner. We have to have a CT scan of your brain if we suspect you are having a stroke, so we can determine what kind of stroke you're having. Either you're having a stroke caused from a blood clot, or you're having a stroke caused from bleeding. And the two treatment modalities are very different for which type of stroke you're having. So after you would have that test, then you would come back to the emergency department, and that's where the team puts together all the pieces of the puzzle. So we want to know things like, it's very important what time you were last well, what time you were last yourself before the symptoms started. So family members are really helpful providing that information to us. We're waiting on lab values to come back. We want a list of your medications that you're on. We put all those puzzle pieces together in the emergency department, and that helps us to figure out which treatment is best for you at that time.
Right. One thing you said that's very interesting to me is kind of make note when your first symptom is.
It's very important to know when it started. Absolutely.
Okay, very good. What is a stroke center?
A stroke center is basically a program that focuses on stroke quality. So we meet as a stroke team quarterly and more frequently if needed, and we go over our outcomes and our data, and we're just held accountable for our actions, and we focus on high quality stroke care.
Right. Do you find in the experience that you've worked with that more women or more men have strokes, or is it
Sure.
same?
It's usually more men in the earlier years, but as women get older, postmenopausal women, we tend to have more devastating strokes when we have a stroke.
Oh, very
So it is
interesting.
very different with women and men.
Right.
It's a lot of the same risk factors as you know about heart disease. You know, women have the hormones, and even pregnancy can be a risk for stroke sometimes. So it's a different disease process.
Right. Okay. What and with the stroke center, what is a stroke team?
So our stroke team is multidisciplinary. We have people from like physical therapy, occupational therapy, speech therapy to help rehab these stroke patients after they've had their stroke. We want to help minimize their deficits, help them get better, get them back to their baseline, get them back to normal. So we have rehab on the team. We have physicians on our team, neurology, emergency medicine, nurses, from the ER nurses to the nurses that take care of you on the floor after your stroke, people from radiology, because the radiology department is important as well. So it's a lot of different aspects, a multidisciplinary team.
Right. So that's specifically for stroke.
For stroke.
That's amazing.
We meet quarterly and more often if needed. Yeah.
Very good and very comforting also to know that you have a team that's that's here in our town that we can feel comfortable and know that you've got it all together. And main thing we have to remember is to get to call 911.
Right, just get there as quick as possible. Absolutely.
We talked a little bit earlier about Hamilton is an accredited stroke program. What does that actually mean?
So we're accredited through the Joint Commission as a primary stroke center, and that basically means that we were surveyed. We were last surveyed in February of this year, and we were renewed certification for 2 years. We're surveyed every 2 years, and a surveyor from the Joint Commission will come on site to Hamilton and basically follow the course that a stroke patient would follow. So this year she started in the emergency department, visited the pharmacy, and went on that way and kind of walked the road that a stroke patient would walk.
Right.
And evaluated us that way.
Very, very interesting. Well, it's congratulations to Hamilton for getting that
Thank you.
again. That's quite an honor. We talked a little bit earlier in the first segment. We showed that FAST or FAST graphic. In case someone missed that, I'd really like to go over that again.
Great idea.
How would you recognize? What are the warning signs and the symptoms? And as you can see, we can pull that up now. Let's go over that if you don't mind again.
Sure. So the acronym is really easy to remember. It's FAST, and the F in the acronym stands for face. As you can see, this lady has asymmetry in her face. Her left side of her face is drooping a bit. Can you see that? And that would be an indication for stroke. F stands for face.
And then,
so the rest of the acronym, A stands for arm. You would have the patient hold out their arms in front of them. If one of their arms was drifting or weak, that would be also be a sign of stroke. S stands for speech. You would have the person say a simple sentence for you. If they had any slurring of their speech or word finding difficulty, that could also be an indication for stroke. And T is the most important letter in the acronym. It stands for time. So if a patient exhibits one or all of these symptoms, you are to call 911 immediately to get the patient to the nearest hospital.
okay. Now, I know that people can take a note of that and make sure that they have that information. Even if you had to type it up on your yourself and put it up there on your refrigerator. These are very important steps to know. If our audience wants to know more about strokes or who would they call, or how would they go about it at Hamilton Medical Center as far as knowing more?
Sure. Then you could have my contact information. It's 706-272-6022. And I also have the fast magnets if anyone's interested in those that the grandson used for the grandmother.
Yes.
Yeah, also, I could give you some of those to put on your refrigerator at home.
I'll take one.
To help with, yeah, sure, I brought you one. And also the AmericanStrokeAssociation.com is a very, very valuable resource for stroke information. They even have an app for your mobile phone, your smartphone,
really?
a fast app. So if you forget what the F stands for, the S stands for, you can have it on your smartphone when the time comes.
Right. Well, that is great information. Again, thank you so much for being with us.
You're
thank
welcome,
you for sharing
Judy.
the story, and fortunately it was a success story of what had happened, a good story for the stroke victim. But again, thank you so much. We appreciate it. Appreciate Hamilton Medical Center for having you come today. And thank you for being with us here on Lifestyles for Women. We hope you've enjoyed this show and have learned a lot about strokes and some signs and symptoms. Until next time, I'm Judy Elliott, and we hope you have a great day. We'll see you next time.